Today, we will discuss smell and taste dysfunction in patients with COVID-19 and the role of Chinese medicine. This talk is only for public understanding, not for any medical advices. If you want to seek help for treatment, please see a licensed health care provider. Pictures used in this presentation were downloaded from internet. Copyrights of these pictures belong to the original author, not me. The outline of today's talk includes background, pathophysiology mechanisms, treatment, acupuncture, and Chinese herbs. Now we know we have more than 10 million confirmed cases in America. 60% of them is symptomatic, and up to 80% of positive cases have smell or taste dysfunction. The recovery rate of smell dysfunction varies. In one Korea report, more than 90% of patients eventually have a full recovery of smell after 7 weeks. However, in an Italy report, after 25 days, only 60% of patients have recovered smell sense. The mechanism of the smell loss is because of damage of the olfactory neuron. So the damage mainly happens in the olfactory epithelium, which is located inside the nose, but not in the olfactory bulb, which is inside the skull or part of the brain. So, and because of epithelium, we see most of patients can have a recovery and relatively rapid recovery. For the treatment of those smell dysfunction, we have olfactory training, intranasal sodium citrate, intranasal vitamin A, and systemic omega-3. However, all those treatments have not been confirmed to be effective. So now let's see how the medical doctor introduced the mechanism and the treatment of this smell dysfunction.
Hi, and welcome to another edition of Your Health with Dr. Lemon, eucalyptus, rose, and cloves. You can do that a variety of ways, but most commonly people use essential oils. For 20 seconds, at least twice a day, you're to sniff these different smells. You should do that for at least 3 months or for longer if necessary. I would recommend that the moment that your sense of smell is lost, you should start doing olfactory training. The hope is that as you retrain the connection between the nose and the brain, your sense of smell will return. Studies have shown an improved sense of smell after olfactory training. And as I mentioned, it's very low cost and there are no risks. So why not go ahead and just do it? I'll put the link to this interesting article in my description. And if you want more information, you can go to the article directly.
And then for acupuncture and Chinese medicine, we have no proved evidence either. However, they have some reports for those loss of smell sense due to post-viral infection. So, and the points used for acupuncture is 216, 220, large intestine 20, and then lung 7. No, the main reason to use these points are to stimulate locally or stimulate the brain, and also the lung meridian or stomach, because we think the smell and the taste sensation belongs to the meridian of the lung or stomach. Here is another point: lung 9 and small intestine 3 and stomach 36. So in one report showing that with the traditional Chinese acupuncture, after treatment, the improvement is much more significantly than that of vitamin B only group. And then in another report, the traditional Chinese acupuncture can also improve the smell sensation score in post-viral olfactory dysfunction. For Chinese herb, again, there is no peer-reviewed papers have been published yet. But in some internet web page, we see some reports of using different herbs. They all claim that it can be helpful. For example, 山脉饮、补中鸡汤, and 甘露消毒丹. Why they are using this? Because we differentiate all symptoms of a patient into different patterns of Chinese medicine. For example, if you have fatigue, dry mouth, and dry nose, and then we can use 生脉饮 for that. And then if you have fatigue, loss of appetite, and loose stool, we can use 补中益气汤. Okay, and then you have heat, and you have the grease toe, and like a tongue coating, we can use 甘露消毒丹, and so on. Okay, so all the reports, they said they can help recovery of the smell and taste sense. And in Japan, there's one formula, okay, and the Japan is called Kampo. It's similar to Chinese medicine, and the one formula is called Tokisa Kuyakusan, which can help recovery of the olfactory epithelia in a mouse model. So see here, this is the lung treatment group. Okay, we see the epithelial thickness is much thinner than that of the TSS group, no matter at day 14, day 28, or day 42, we see a much thicker olfactory epithelia in the TSS treatment group. So remember, we said that the loss of smell sensation is because of damage of the olfactory epithelium, not the neuron. So that is why this TSS can help recovery of the smell sensation. So for my personal experience, I use individualized herb and for every people, and because this is the best formula for each one. And I will use some herbs of moving blood, and because it has some experiment and evidence, and then at the same time for every people, if you want to do the treatment, you have to do it regularly and be patient. We treat people 1 month as one course, okay, and then usually 3 courses we will evaluate effectiveness, but mostly majority of people will see some improvement after 2 to 4 weeks. Okay, and at the same time, we found that the shorter duration of symptom, the better the prognosis is. For example, if you have a duration of 4 weeks after the onset of COVID, and then the prognosis is much better than the duration of 6 months after the onset of the COVID. If you have any questions, feel free to send me email, and I will be happy to help you to answer any questions you may have. So at the last, I wish you all the best, and you have a normal and health, smell, and taste sense. Thank you.